So if you or a loved one might need a liver transplant, what does that process look like? If you have a chronic liver disease, a liver doctor determines whether you need a transplant mainly based on your MELD score. This uses 4 lab values from blood tests to determine how sick your liver is. A liver transplant is far from a benign surgery. There are significant risks associated with the surgery itself and the immune-suppressing medicines you have to take afterwards. So if your liver isn't damaged enough to result in a high enough MELD score, the risk of transplant outweighs the benefit. Once you have a high enough MELD score to need a transplant, you don't just get put on the transplant list though. You need to undergo a ton of testing to make sure your heart and lungs can handle the transplant surgery and to make sure you don't have an undiagnosed cancer or other illness that could affect your lifespan afterwards. This means echo, colonoscopy, mammogram, and more. You also need to get vaccines, take classes on post-transplant care, go through alcohol counseling if alcohol contributed to your liver disease, and more. Livers are a scarce resource, so the review process is thorough. If everything checks out, then you can finally be listed on the transplant list. Then your MELD score determines your place on the list. The sicker you are, the higher your MELD score, and the higher you are on the list. Someone who's only been on the list 2 days could get a liver before someone who's been on the list for months. This ensures that each available organ reaches the person who needs it most.